Yeah, well, I've always been really interested in hospital administration. I have had administrative roles really since the beginning of my work in anesthesia at Kingston Health Science Center. And I initially got involved with being medical director of our pre-surgical screening clinic, and I really enjoyed that work. And then I started to really get interested in policy development for my department, and I really enjoyed that work. So I think that was a really good stepping stone to work within regulation. I was actually invited to participate in developing standards for an independent health facility a number of years ago, and that was really the first work I ever did for the college, and I found it to be very rewarding and interesting work, and so I was really happy to get involved with that. And then I got involved in doing some investigations through ICRC, and again, that was very interesting and compelling type of work. So I was really I was very happy to be working with the college, and then I had an opportunity to be appointed as the academic advisor for Queens on the CPSO Council. So then that opened up a whole new window into opportunities at the college, and so it's really been a very rewarding and exciting 5 years, and I'm really looking forward to next year to be serving as president. I've been lucky to be part of the policy review working group now for several years, and so I've really been able to see in action how important the feedback is on policies as we develop them. So, there are a number of policies at the college, and they go through a regular review process. So every 5 to 7 years, those policies are looked at in a very comprehensive manner. We do a jurisdictional scan to get information about what's happening in other jurisdictions. And then we send the policy out for feedback, both to the public and to all physician members, as well as to our various stakeholders like the OMA and Paro and medical students. There's tremendous feedback that we get from these organizations on all of our policy review. And what we find is that, even though when we've done the work and the background work and we think we have a really great draft, really seeing it from another person's perspective and really having a full understanding of how a policy might affect a certain group of individuals, both public and physician members, really can influence the final version of the policy. So I think that that feedback is really key, and is certainly taken very seriously by the working group, and really helps to develop and create a policy that is really workable for our members and ensures that the public is well protected. Well, I think, 2022, we're hoping is going to be a really exciting year with us coming out of the pandemic. Of course, we sort of probably thought that was maybe the case for 2021 as well. But I think with, the broad use of vaccinations that we're going to be seeing, hopefully moving to truly the endemic phase of COVID-19, and getting back to our regular work, which is very, very important. Unfortunately, we have an enormous backlog of work that didn't occur during our various slowdowns. And this is going to be very difficult for physicians to not be able to provide necessarily all of the care that they'd like to for their patients. And this has a tremendous impact on physician wellness. There's a certain moral injury that happens when you know that there's care that patients need that you may not be able to help them with. So I think physician wellness, coming through 2 years of tremendous work and burnout, we're going to be seeing difficulties with physician wellness, and we're really going to need to support our physician colleagues. So that's one area that I'm very committed to. I think we're also going to be seeing some very interesting and challenging and important policies that are going to be coming through their final versions. So that will include what used to be the telemedicine policy, but is being renamed as virtual care. And we know that virtual care was essential in the early stages of the pandemic, and that we're facing some challenges now with finding the right place for virtual care as we move forward. Obviously, it's a very useful tool for physicians and for their patients. But we need to find that right balance, that we're using virtual care in the right way. Also, social media. The college has had a social media statement since 2013, but they're currently drafting a new policy around the use of social media. And we've seen, the tremendous benefits of social media during the pandemic to be able to pass along important information in a timely way. And we've also seen some of the downsides of social media around the use of misinformation, as well as unprofessional behavior. So I think these are two very important policies, and the implementation of these two policies will be key next year.